Right, okay. I think we're going to make a start. So welcome everybody to the Medical Debate session 15. And today we're going to be talking about stem cells and some of the ethical issues surrounding those. So first of all, we're just going to introduce you to stem cells and discuss the different types of them. And I'm sure most of you are already familiar with the main types of stem cells, but we'll just go over it. So the majority of cells differentiate into other cells which have a specific structure and function. And stem cells are undifferentiated cells, so they have the potential to mature into a wide range of different cell types. And another property of stem cells is that they can self-renew or make copies of themselves. So the three main types of stem cells, the first type is embryonic stem cells, which are obtained from the blastocyst, which is a hollow ball of cells formed 3 days after an egg is fertilized by a sperm cell. And this is around the size of the dot above the letter I on the screen. And these cells can be described as being pluripotent, which means they can give rise to basically every cell type in the body, with the exception of the placenta and the umbilical cord. And obviously, as you might expect, these are the ones where people have the most ethical concerns surrounding them, due to the fact that they're taken from a fertilized egg. And adult stem cells are another type of cells, and they're also called somatic stem cells. They're more specialized than embryonic stem cells in the sense that they can only differentiate into a limited range of cell types, which include, red blood cells, white blood cells, platelets. And they're typically found in the bone marrow, but they don't self-renew as easily as embryonic stem cells. And the third type is induced pluripotent stem cells. And these are basically where you have an adult stem cell and you engineer it in the lab to behave more like an embryonic stem cell, which obviously is quite useful because it avoids many of the ethical issues surrounding embryonic stem cells, but using adult stem cells instead. And these are usually produced by using viruses to insert extra copies of genes into these adult stem cells, and therefore they can be used in cloning living organisms. We're going to talk mainly about embryonic stem cells in this session, but regarding that the last type we discussed, induced pluripotent stem cells, can you think of any ethical issues surrounding that maybe? So perhaps if you want to, in the chat, maybe just think of any ideas you have. Yeah, please put them in, and then we can maybe. Right, so someone said religion altering God's creation, right? So this is, I think genetic engineering in general is kind of, that's one of the main factors that people have to consider, religious concerns. And many people who are religious believe that God has created us in a certain way, and we shouldn't play God, as someone else has put in the chat. We should respect what he's created and use only what he has created for us. And yeah, so that's a very big issue that people have to take into account. And yes, and cloning as well. I wonder if anyone can think of some of the ethical issues surrounding cloning, because iPS cells are used in cloning. Right, yeah. So someone's put slippery slope, like how far is this going to go? With cloning, yeah, I think that's that's a good phrase to describe it, slippery slope, because obviously, cloning, if cloning were to become quite mainstream, it's kind of a science fiction sort of idea, in Star Wars. I don't know how many of you have seen Star Wars, but Star Wars, during the Clone Wars in Star Wars, where, clones, there were millions of clones who were all cloned from a single host, and especially in the animated series, the Star Wars: The Clone Wars, one of the main issues that is discussed is the rights of clones. Should they be, are they expendable? Or should clones just be allowed to die, or do they, should they be treated like living humans with actual feelings? Because that's what they are. But also regarding cloning, some people think stuff like genetic engineering can be used in stuff like designer babies. I don't know how many of you have heard of that idea, but I think we have discussed it in the past. But stuff like, is it is it right for, us to genetically engineer a specific type of child or a baby with certain characteristics that are deemed desirable? So someone else has put the unknown risks in the future from cloning. I think that's cloning is a very new thing, still relatively new. Modern cloning is new. And we don't know the risks of cloning. Dolly the sheep, I'm sure you've heard of Dolly the sheep, or the first mammal to be cloned, I believe. And it took God knows how many attempts to clone Dolly the sheep with, huge costs as well. Someone else has put, well, we don't know all the functions of a certain gene yet, so it's very dangerous as we could alter a gene and therefore alter the function it usually carries out. Yes, that's another issue. And also stuff like turning on and off certain genes is something which has come up, in the past that can lead to certain risks and, mutations, obviously tumor formation and cancer. And I think the last point I'll read out is it's like depriving the clone, which is basically alive, its chance to experience life. That's interesting. Yeah, as well. If you do clone embryos, or take embryos and use them to produce more different clones of a certain from an original cell, but is it depriving, if you're using them for scientific purposes and instead of allowing it to grow into a human, is that depriving it of its right to achieve life? Should it be a right for embryos to experience life? So that's something we'll consider today. Regarding embryonic stem cells. So we're going to move on now, and I think Sudan's going to explain this article.
Yeah, so actually one of the people on the Instagram actually messaged us about this article, and we found it very interesting, and that's what the presentation is based on. So in early October, US President Donald Trump received a so-called cure for COVID-19, a variety of monoclonal antibodies developed using fetal cells aborted decades ago. Remdesivir, hopefully I'm pronouncing that right, an antiviral drug also used by President Trump, was also developed using aborted fetal cells. However, in the past, President Trump has heavily criticized abortion. In fact, I do believe he said that he would support a near-total ban, a nationwide near-total ban, and research into embryonic stem cells for medical purposes. So just taking that information, and if anyone wants to unmute themselves, then do so, or if you want to put it in your chat. What do you think about this? Should someone that's so heavily a critic of abortion and using, that whole topic, should they be allowed to use substances derived from embryonic stem cells? So popping up in the chat. So knowing Trump, he probably didn't have a clue what was in the drug. I mean, I don't want to say that's true, but there was something in the news where they said that the head doctor actually did some shady things and tried to cover up things and tried to use non-tested, non-FDA approved materials for Trump's health. Does anyone have any other ideas? And this is not just a ranting on Trump session. Feel free to unmute yourself, put something in the chat. So it's a bit hypocritical, but due to the patient autonomy, you have to respect their rights. And if that's what he wants, then he's entitled to it. On a normal basis, whether it's Trump or not, you cannot advocate against something but use it when it benefits you. Yeah, so that's again the hypocrisy of it, that he's against it, but then he used it, and as he says in his rallies and his various speeches, he says he's immune to COVID now because of it. So yeah, again, there's no right or wrong answer, but I can see a pattern emerging.
Right, should we move on perhaps here?
So this is obviously a big argument that when does a human actually begin to exist, right? So especially with abortion or embryonic stem cells, or the whole issue surrounding would they feel pain, and are you killing a human or are you killing a bunch of cells? It's quite an important issue and it's quite controversial. So does anyone have any ideas about you know, when is something actually alive? When is something actually a human being, like an embryo? When does it properly turn into a human being? In which case, it's completely unethical to kill it off. And you know, is there a cutoff point, or is it just a gradual process? Does anyone have any ideas? So certain religions believe it's at the point of conception, okay, but others believe. So obviously, while you're typing that, I do know that lots of other people believe that it's after the second trimester. So at the third trimester, then the people start believing it to be actual human being. The person in the chat said, whereas others believe it's at the point of birth, which is also, I mean, that's obvious that as soon as someone's born, and it's obviously a great cutoff point, is that when something is born, it is a baby, it's a human baby. You don't call it a fetus. You don't say it's a he or a she. It's a human being, very much a human being at that point, and it started its life. So yes, that's a very good point. And someone else says that when fertilization occurs, since the zygote starts to develop, and that's when they turn into a human. And so we're going to be talking about this now. So when a sperm fuses with an egg, a zygote is formed, which grows into an embryo. After dividing and differentiating, the embryo grows into a baby. And this is, you know, questionably where people say that the human is alive, or it is indeed a human. Different people have different opinions on when this group of cells is deemed alive, like we've discussed. So one of the viewpoints is that when the group of cells is a human being as soon as the sperm fertilizes the egg. So someone said at the minute of conception, when the group of cells becomes a human being as soon as the first stem cell differentiates. So at that point you start, like that's the start of differentiation and making a unique child. So that's possible to be classified as a human being, because that's when it has its own characteristics that are different from anyone else's. The group of cells becomes a human being when all organs, including the brain, are developed. This is obviously a very cogent and very obvious argument that when I believe it's an embryo at that point, when an embryo at that point has all its organs, then it's ready for birth. And once it's ready for birth, it will start its life as a human being. So that's a very, very good, that's more widely accepted, and a very widely accepted view of when the zygotes become a human being. And then also when the group of cells becomes a human being when the baby is born. So that's, again, like we talked about, that's also another huge point.
Yeah, and also I think someone in the chat has said when fetuses develop their senses, like hearing and sight, that's the point at which they become a human. And that kind of links to the third point we've got here. You know, when all organs are developed, then they can be classified as human. But we're not here to tell you that, you know, one of these is right or one of these is wrong, because, you know, this is subjective and people don't really know when, because obviously it's a continuous process growing into a baby. So, you know, that's why there are so many concerns surrounding this. But we're going to move on now. And so human embryos at the zygotic stage are defined as whole living members of the species Homo sapiens, which possess the epigenetic primordia for self-directed growth into adulthood with their single identity fully intact. So that's the definition of a zygote, essentially. And so many people actually use this definition, the scientific definition, to classify or to justify the classification of zygotes as being alive, due to the fact that zygotes are whole living members of the species, which have the potential to grow into, you know, adulthood. They can be classified as alive. But then others also criticize this classification due to the concept of identical twins, which are formed usually after the zygotic stage. And since that results in a single zygote becoming two separate identities, that, you know, contradicts this definition, because the original zygote did not grow into a, you know, preserve its single identity. It split into two different identities. And then again, people argue that the cells which comprise the zygote don't function in a coordinated way to regulate and preserve a single life. And that's kind of the definition of a multicellular organism, you know, with different cells working together to preserve a single life. And since the cells in a zygote do not do this, people again say that it shouldn't be classified as a living organism. whereas, when the organs are developed, then it perhaps can be. So we're just going to ask you now in the chat perhaps to give your views on this. What do you think, at what point do you think a group of cells should be deemed as alive? Do you think it should be at the point of conception, at the point at which the baby is born? And perhaps, give your reason behind it, considering what we've talked about.
I just wanted
Yeah,
to say, Shivas, actually, someone did ask me this as well, like what my opinion is. And
yeah,
personally, I believe, just to get the ball rolling, I believe it's when at the initial instance of pregnancy, when the sperm and the egg fuse. I think at that point you should start. Personally, I would call it alive and a human being, because that's when you start the process of pregnancy, and obviously pregnancy gives birth to an actual human. So that's just my view. That doesn't mean it's right or wrong, or it means anything, but that's my view. Does anyone have any other views? Feel free to disagree with me or agree with me.
Okay, so someone said, I think at the point at which the complex nervous system forms, yeah, okay, so that's interesting. So that's linking more to the idea of when, the tissues are and different organs are intact, and at which, they start sensing, really. Someone else has said it's at the point of conception. Right, someone else has said when the group of cells have to rely on each other to survive, so it's more like an organism. Right, okay. And someone else has said, I agree with that. I would say the organism is alive at conception. I think when the heart is formed and is beating. Right, so there is a range of ideas here. And I think, there's a split really between people saying it's at the point of conception and the point at which certain organs are formed, which is interesting. And I think the reason we're having this discussion is because the main argument people have against using embryonic stem cells is that it's murder and it's killing someone. Yeah. So basically, I think because due to the fact that embryonic stem cells are, used in medical research, and then taking them from an embryo could be classified as murder, therefore. But if they aren't deemed as alive, then perhaps it wouldn't be. Sidan, I don't know if you want to explain, about the heart, perhaps.
Yeah, so actually someone raised a very, very interesting point about when the heart is formed and is beating. And actually that's quite an interesting point, because if you think that when the heart is, again, not disagreeing or agreeing with you, I'm just saying, just to ponder the implications of that. If you believe that when the heart has started beating, that's the start of life, then does that mean that when the heart stopped, that's the end of life? Because when we covered death and when we covered DNRs, there were 3 types of determining death, and it doesn't necessarily. There are views of expressing, certifying that someone's dead when their heart's still beating but their brain is dead. So does that mean that they're technically alive in your viewpoint?
That's an interesting point, yeah. And should the heart be the determinant as to whether someone is alive or dead? Because as we know, if someone's heart has stopped beating, that doesn't necessarily mean they're dead, because they have the potential to become, recover and potentially be alive again. Right, someone's made an interesting point here. Playing devil's advocate, as a zygote is a potential baby, a seed is a potential tree, but you wouldn't call a seed a tree. Yeah, that's interesting. And obviously we're comparing it to something which is inanimate, not really the same thing here, but it's an interesting point. Should we treat zygotes as potential babies, or should they be treated as a completely separate entity? Since zygotes can't make decisions due to not, having a brain, due to not being able to express autonomy, that kind of thing, should they be treated as living things, or should they be treated as, inanimate objects, perhaps? Right, yeah, so I think we've had a good discussion surrounding this, so I think perhaps we'll move on. Actually, one second. Before we do, I think someone's made just one last point that we'll discuss. Someone said you can look at it that way, but if there's a heart and it's beating, then there's circulation, there's blood flowing through an alive organism, which seems like life to me, even if they're brain dead. It's an interesting point, yeah. But that's why we're having this discussion. Someone else has said, since we determine death when there's no activity in the brainstem, should we use a similar concept to when life begins? So I assume perhaps you're saying that when the brain is fully formed and functioning, then that's the point at which we can determine something as being alive. Yeah, so there are different definitions, but as we mentioned in previous webinars, there are different definitions of death as well. There isn't a clear point that's agreed at which death occurs, or indeed at which life occurs. Yeah, so Siddhan, I don't know if, yeah, perhaps we'll move on to the next slide now, yeah.
Right, so this is just to cover a bit about the uses of embryonic stem cells. So we talked about the pluripotent nature of embryonic stem cells earlier, and the fact that they can be used in various different ways. And these include the following. So embryonic stem cells can be used to regrow certain types of cells which have been damaged. Nerve cells in the brain can be regrown to treat illnesses like Alzheimer's disease. I'm not sure about that point. I don't think you can treat Alzheimer's. I'm pretty sure that's a very hypothetical and research-based area of development, but let's gloss over that for the point being. Retinal cells in the eye can be regrown to treat blindness, and insulin producing cells can be regrown to help people with type 1 diabetes produce enough insulin, reducing the need for injections. Again, I'm not sure about the last one either, because that would potentially mean that there's a cure for diabetes, which there isn't. Can anyone think of any other uses of embryonic stem cells? That's a good question, because obviously again, if there was one cure fits all type of stem cell, then we could possibly cure any disease where cells are desensitized to the body, or they're not working as they should be, or there is a deficiency of a certain type of cell. Does anyone have any ideas of any other uses, or anything like diseases that could potentially be solved if we created perfect embryonic stem cells that could regenerate those cells or have any effect? Anyone got any ideas? So someone said cure congenital heart diseases such as ASD and VSD, or drug testing. Yeah, that's a very good point, because especially with doping in sport could help with recovery. Could you please elaborate on that? What do you mean by recovery? Recovery of what? To prolong life in general. Yeah, so that's a good one. Because there are so many mutations. So obviously, as everyone knows, that mutations happen consistently, and you've had, just sitting here, you've had many mutations taking place, and so some of these mutations can be more harmful than the rest. And if it's possible to create embryonic stem cells which regenerate a certain type of cells which a mutation has possibly caused a deficiency of, or if there's a genetic disorder, if you're susceptible to a genetic disorder which such as diabetes, such as or any disease with a genetic factor, then it's quite important to realize that these stem cells, or any type of stem cells, could actually be used quite effectively to stop or at least decrease the effects of certain diseases, because they would be able to specialize into a different type of cell. They'd be able to create different uses. And again, this is very versatile. So again, if you want to research this, I highly recommend you do, because this is a very versatile area of research, and it's quite it's quite varied. So look into it.
Yeah, I think we've got a few more points here that people have mentioned. I don't know if you want to go through.
Oh, right, yeah, sorry, I didn't see these. So I believe they can be used to treat things like hemophilia, sickle cell disease, Parkinson's, recovery from injury, 3D printing. Oh, 3D printing is a very good one. So by 3D printing, I assume that you mean 3D printing, like they said, organs. So if you can 3D print a working organ, that would potentially work in the same way as regenerating an organ using embryonic stem cells. Could you just clarify what you mean, in case I'm wrong? Yes. Okay. So 3D printing. I don't know if anyone's seen this, but they have created a liver, or at least a model of a liver, using 3D printing. Now, obviously, there's lots of problems with this, because it's very hard to find a perfect, always working material, which would be compatible with your body, wouldn't be rejected, and you wouldn't have to take immunosuppressants to be actually using it. But again, it's very important to realize that, again, this is an area of research, but that's a very, very good point. Hemophilia. So hemophilia is when, for anyone who doesn't know, hemophilia is when you have you have the inability of blood clotting. You can't clot blood. So that means that if you have a cut, you can bleed a lot more than a normal person would, because your platelets and your white blood cells, and they don't work in the same way, so they don't clot as easily. So you can lose a lot of blood. And it's quite serious, because something that we would take for granted, like, a cut on the finger or something like that, that can actually be quite dangerous. And I'm just thinking, I'm not sure, I'm not well read on hemophilia, so I'm just thinking what could, so I guess if you could use asthma, if you could use embryonic stem cells to increase the count of platelets, or to increase the count of white blood cells, which would be effective to that person's body and blood type, then possibly, yes, it could be effective. But again, so every, if embryonic stem cells and any stem cells and 3D printing were all perfect, then it's quite possible we could cure every disease. But again, they're all areas of research. None of this is perfect. And, we don't know enough about any of this to be able to say that something would definitely be perfect if we could use it. Someone said that I've heard of using it for spine injuries, but there was no significant improvement reported in the treated patients. Again, medicine, one of our previous guests said that medicine is as much of an art as it is science, that people don't see that because, they think of the huge textbooks, and they think of the, doctors wearing huge glasses because they've just been in the library. But it's true, because not everything's perfect in medicine. We can't cure every disease. And so, it is a trial and error process. And obviously, if it was able to be used for spine injuries, that would be amazing. But I guess, in the study that this person is talking about, clearly there was not significant improvement, which is, not to be unexpected in medical trials. Could it be used for hair loss? I'm not sure. Maybe it could be used in things which cause hair loss, such as alopecia. I believe it's alopecia. I don't want to say anything wrong. But possibly. Again, I don't know enough about it to tell you yes or no, probably, definitely, definitively. But again, area for research. Yeah, just the thing, we'll move on.
Yeah, just about that hair loss point. I did actually read an article recently about saying that, follicles can be regenerated using stem cells. But as we've mentioned, all of these sort of potential uses are hypothetical, really, in the sense that none of them have really, of course, they all show promise, but none of them have really been successful in the sense that they can, as a definite treatment. But yeah, just before we move on, someone said there are risks like the formation of teratoma of the undifferentiated cells, and it could be very dangerous. So yeah, that's one of the risks, I suppose, which we have to consider alongside the ethical issues. Right, so I think we'll move on now, and we're going to discuss now the use of spare embryos. So I'm sure many of you know already a bit about in vitro fertilization, which basically is a form of fertility treatment which can allow a woman to become pregnant where she otherwise would not be able to. And the way it works is it involves the implantation of several embryos into the uterus, which is done to increase the chance of success, because usually these treatments have a very low success rate. And if one of these embryos does begin to grow, then the others can be removed, and then it's up to the individuals for whom the embryo was created to decide how they are going to be used following that. And the main sort of decisions that can be made are donating them to other couples looking to undergo IVF, donating them to laboratories for scientific research, or discarding them, which would destroy the embryo. So we're going to discuss now which of these options you think is the most ethical, and just taking into account the 4 pillars of medical ethics, which we've discussed previously, those being, beneficence, non-maleficence, justice, and autonomy. And then linking to those ideas, perhaps we can talk about whether the destruction of embryos should be banned completely, and perhaps we should only allow people to choose between, donating them to others or donating them to labs, or perhaps should it be, should patients not even be given this choice in the first place, and should it be up to medical professionals and scientists to make this decision, using their expert knowledge of how those stem cells could aid humanity as a whole. So yeah, I wonder if in the chat perhaps you could maybe put some of your ideas. Someone has mentioned, someone has just asked me about the article that I read regarding hair loss. So yes, I will send it the link a bit later. Yeah, so someone has said most ethical would be donating them to other couples because the whole purpose of IVF is to help those unable to have children normally. Yes, I suppose that's true in the sense that the whole point of IVF is to use those embryos to create life, and therefore donating them to other couples would be, would still allow the embryo to potentially go on to, become a living organism. So yeah, and someone else has said, well, to respect autonomy, the couple would be allowed to, oh yeah, sorry, and the point before, I guess that links perhaps to beneficence as a pillar. Someone else has said, with respect to autonomy, the couple should be allowed to discard them. They don't necessarily have to accept their potential child to be someone else's, if that makes sense. Okay, that's an interesting point. And of course, right now, that is how, people are entitled to whether, the decision to discard or destroy these cells. And yeah, so I guess that's one of the main arguments in terms of patient choice. So someone else has said, you can consider the view that the embryo has the right to live and discarding it would be seen as murder. Yeah, obviously that's one of the main issues surrounding this. But then also you could perhaps suggest that, donating them to labs could also be murder because they wouldn't be allowed to grow into a live human being. But then also perhaps you could make the argument that since IVF has such a low success rate, if you had embryos which were, unsuccessful from a certain uterus, one of them that was removed and could be donated to someone else, that doesn't guarantee that they'd be, grow into a live human, considering the low success rate of IVF. So taking an embryo and, giving it and making a decision knowing that it could end up dying, and then perhaps being unusable completely, is that a better decision than just giving it to scientific research, which almost guarantees the knowledge that it could be used to help people's lives, perhaps? Yeah, it's a difficult decision, really. And someone else has said, isn't the first choice similar as, donating your children to other couples? Yeah, it can be seen as that, but again, it raises the issue as to whether we want to consider embryos as being alive or not, or being humans or not. Yeah. And also, it sort of raises some similarities and some parallels with organ donation in the sense that people can donate their organs if they want to, but they shouldn't be forced to. That's kind of the consensus we came to when we discussed organ donation in a previous session. And yeah, someone else has said, from a utilitarian point of view, justice, the research that laboratories could develop may improve the health of thousands of people. Yeah, I think that's one of the main reasons. Should we allow one person to be born and to grow up into a human, or even give them that chance, because obviously we know that it's not necessarily successful? Or should we risk using this embryo to potentially create a human, or potentially die? Or should we use it for scientific research where we're guaranteed to produce perhaps scientific evidence and to conduct more research and understand how we could potentially improve the health of thousands of people? So yeah, someone else has said, wouldn't that be a bit similar to abortion if the choice would be discarding them? If abortion is legal in the country that the couple is in? yes, but again, the point of I think this is, you know, abortion with aborted babies. They, you know, the embryonic stem cells can be harvested. It's a similar situation to IVF, although yeah. So it's a similar idea, and it is quite similar, yeah, in terms of the choices that can be made afterwards. Um, Right. So I wonder if anyone wants to answer the third question up here, which is, should patients be given this choice? Do you think that you know, patients should be allowed to make the decision to discard the embryo? Someone's already said that patients should be entitled to that autonomy, but you know, does anyone else have any other ideas regarding that? I mean, just to perhaps get the ball rolling, I think personally, I do agree that patients should be given the choice, even if that choice is to discard the embryo, which of course some people would disagree with. But I believe that since the embryo belongs to the patients, they should make that decision on behalf of the embryo. As you know, someone has said, you could argue that embryo has patient autonomy. Right, so that's an interesting point. Should we classify embryos as patients? Are they entitled to the same rights as, you know, patients, you know, normal patients should be? They can't speak, they can't, you know, express their autonomy, but the owners, or not the owners, but the people who are allowed to make that decision can express autonomy on their behalf. Um, but you could argue that embryos don't feel pain, they don't, you know, so therefore killing them or destroying them wouldn't have much of an effect, as in the sense that they shouldn't be entitled to, um, you know, ethical pillars like non-maleficence, because it doesn't really matter in the sense that they're not feeling pain, and therefore harming them should not be a concern. Um, Someone said, I think they should have the autonomy since it's theirs. Okay, so yeah, I think we've had a good discussion on that now. Right, someone's just one last point. Someone said, I think patients should have full autonomy, but they should be well informed on all options available. Right, and I think I agree with that. I think personally, I believe that patients should be allowed to, you know, undergo whichever option they believe is right. Um, but they should be aware of the options and also aware of the potential benefits of each of these options, really, and the risks and the ethical concerns surrounding each of them. Um, yeah, so I think we'll move on now, and we're going to discuss an interview question, kind of summarizing um, everything that we've discussed. But actually, before we do that, I've just noticed one last point on the chat. Someone said, to be honest, if there was an embryo culture, such as bacteria culture for research purposes, I wouldn't view these as alive, um, as um, as they won't have a chance to develop. Not sure if that makes sense, difficult to put into words, sorry. Using dead bodies for science seems the same as using embryos. That's interesting, although you could argue that dead bodies don't have the potential to develop into living organisms, whereas embryos do. Um, but yeah, are we? And also, yeah, it's an interesting point considering that we do kill bacteria, you know, all the time, and in science there isn't really any ethical issues surrounding killing bacteria. Um, so should we treat embryos in the same way? The fact that they're potential humans, should that mean that they're entitled to the same rights as living humans, or humans which are developed? Yeah, anyway, I think we'll move on now to this interview question, summarizing what we've sort of covered in today's session. So I'll just read it out loud. Is the use of embryonic stem cells justifiable, considering both their benefits and the ethical concerns surrounding them? So we're going to start off with looking at why the use of embryonic stem cells is justifiable. Sidan, actually, I think, why don't you take this one? And you know, we'll just, perhaps you can put in the chat, everyone can put in the chat their opinions regarding all the points we've learned, we've talked about today. You know, the benefits of embryonic stem cells, and the fact that perhaps their ethical issues surrounding them might not be so significant. Yeah, so please, and also if you'd like to unmute yourself, please do go ahead and do that.
Yep, sure. So does anyone have any ideas? Okay, so someone said that the benefits outweigh the concerns. Why? Could you explain? Because they can provide treatments for many diseases. That's true. Any other and give life example in IVF? Yeah, that's correct. Does anyone else have any ideas? If not, should we? Oh, in addition, the process. Oh, wow. Okay. In addition, the process sets into it's so expensive and touching more lives and saving the last. Yeah, I mean, all great points. Shavas, if you want to press the slide.
Yeah.
Yep. So embryonic stem cells. I guess we were able to. Yeah. So embryonic stem cells have the potential to treat a variety of diseases and conditions, including blindness, diabetes, and paralysis. As we talked about earlier, the medical implications of this are quite huge, and we can use them. We potentially could use them for quite a few ailments and quite a few disorders, which possibly could cure lots of problems and symptoms, which could be life-saving. But again, this is all highly research-based at this point. Discarded embryonic stem cells can be used for medical research purposes rather than be destroyed. This is so. I'm not exactly sure on how they could be used for medical research purposes, but I guess that's true. Embryonic stem cells are pluripotent, so they differentiate into a wider range of stem cells, thereby having the ability to help treat diseases. So beneficial in that sense. However, there are ethical concerns on whether we have the right to use embryos. It's justifiable because you can save many lives. Utilitarian point of view is doing most good by using them. Benefits could outweigh the ethical concerns. So yeah, really well done for using the ethical theory we talked about a few weeks ago. Utilitarianism, that yes, it does help people, but then you have to realize that autonomy says that autonomy, injustice, and beneficence and non-maleficence, they all state they have points of view on either side, because some people will want to won't want people to use them, etc. So you should consider each side, but that's really good. The ethical concerns regarding the use of embryonic stem cells, like we just talked about, should be minimal, as embryos are thought to be non-sentient beings and for many are not perceived to be alive. So this is again quite controversial, because some people do believe that embryos are sentient and some don't. So that depends on people. Again, that's autonomy. And regarding the minimal concerns, again, that's highly subjective, so I doubt that's true. But again, it is possible to save lives with this. And so if for the people that don't believe that embryos are sentient or alive, then I guess in that respect that the ethical concerns are minimal. So someone said that beside the ethical concerns, I think risks should be considered as well, and the cost in comparison to other possible treatments. Yes, that's true. So there would be, because we don't know much about them, it's possible that the risks would be quite high. And it's also possible that the cost would be quite high, that if it is such a, if it's a research thing and it's fairly new, it's quite possible that it wouldn't be available to everyone. It'd be quite inaccessible. And embryos would not experience any pain when being destroyed. However, halving them could lead to other lives being saved. Arguably, these lives are more valuable. So again, this is very subjective. Some people will not believe that lives are more valuable than others. Some might. That was actually a huge debate with the Trump case as well, that is Trump's life more important than a baby's, and etc. etc. So it's quite important to discuss this. But again, all of these are heavily ethics based. So take anything we say with a grain of salt and try and come up with ethical views and see both sides of arguments. And someone said that justifiable for reasons already mentioned, especially the use of umbilical cord stem cells are considered more ethically approved. Again, that's quite possible, because some people would say that umbilical cord obviously is not sentient and it's not a living thing. So if stem cells came out of there, then it's more ethically acceptable. But again, this is all subjective, and it depends on people's own ethical views. It's not one. It's not one theory for everyone.
Yeah, and I think the last point on the slide about lives being more valuable, certain lives being more valuable than others, it's quite an interesting and obviously controversial point to make, but it's something that we have sort of looked at throughout these sessions with different issues, like regarding organ donation. Should someone who is older and perhaps going to die sooner and perhaps has fewer family members, should we perhaps not give them the same treatments as people who are younger and perhaps have their whole life ahead of them or something like that. It's something that we've had to consider in the past. But it's an important point in the sense that an embryo could be a whole, have a whole life. But is their life more important than someone who is already alive and already has a family and already has, a future already determined for them? Which is, yeah, it's an interesting point. But I think now we're going to move on to the other side of the argument, why the use of embryonic stem cells is not justifiable. And you can talk about the ethical issues, I think, mainly for this point, but also perhaps the risks of using embryonic stem cells, and the cost as well, as someone's mentioned. So yeah, we'll just give you a couple of minutes to put your ideas in the chat. So someone has said, but if research would be able to somehow significantly minimize these limitations, i.e. the risks and costs, then its benefits would outweigh the risks. The procedure of acquiring embryonic stem cells should also be ethical as well. Yeah, so someone did mention, I think we mentioned umbilical cord stem cells, which is an alternative, and also induced pluripotent stem cells as an alternative to using embryonic stem cells. If we are able to establish a method of ethically obtaining stem cells, then perhaps, if the ethical issues aren't as significant, we'll just have to focus on the cost and the procedural risks of using them, like we would with any other medical treatment. So yeah, that's one point. Perhaps why we shouldn't use embryonic stem cells, but because there are alternatives that can be used instead. Right, so someone else has said, a lot of couples choose not to have any children. That doesn't mean they can't have any. Maybe they should consider donating their gametes. Right, so yeah, so so that's true. A lot of people, perhaps we can say that using stem cells has the potential to, allow other babies to be born. Yeah. Someone else has said, it depends what you use it on. Like designer babies and perfecting life isn't a valid reason to use embryonic stem cells. We should just be using them to treat chronic conditions which could save lives. Right, that's an interesting point. So you're saying perhaps that the use of embryonic stem cells is justifiable as long as it has a direct link, or it directly allows a life to be saved. Therefore, meaning, that they're, instead of being used for research purposes, perhaps, or ethically controversial purposes. I did notice someone put their hand up. I don't know if you wanted to unmute yourself and make a point out loud. Maybe not. Okay, well, yeah, right. So, yeah, but then also your point about we should only be using embryonic stem cells to directly save lives. That again raises the issue of, is it right for us to take one life in order to save another? So yeah, and I'm just going to put up on the slide some of the points that we've got. Some people argue that all lives have the same value, and since embryonic stem cells have the potential to grow into human beings, they should be given the same right to life as us, and therefore using them and harvesting them is murder, according to some people. And also IVF requires the use of multiple embryos, some of which may be destroyed. Is it fair to destroy several potential humans in order to allow one to grow up? And also, again, there are other methods of stem cell research that could be explored, including induced pluripotent stem cells, which can avoid the ethical issues surrounding embryonic stem cells. But as we mentioned at the beginning, there are obviously limitations to using these as well. Right, so yeah, and I think we've all, come up with some really good points today. But I wonder, just, to finish off, if anyone has any other suggestions for perhaps alternatives to using stem cells, or perhaps ways in which we can use embryonic stem cells, but, reducing the ethical limitations of them. I don't know if anyone has read anything interesting regarding this, which they'd like to share. Okay. No, I don't think anyone has. Right, someone has said about the hair loss article, right. Okay, I'll try and get that link. Actually, I don't know if I'll be able to get it right now, but if you look on our Instagram, I'll be able to send it there. Our Instagram is at the medical debate. Yeah, I'll send it on there, so hopefully you'll be able to access it then. Right. Okay. So I think we've come to the end of the session now, really. And yeah, so I think we've had a really good discussion today, and we've talked about some of the ethical limitations of using stem cells. Actually, someone has mentioned a final point, perhaps. Someone said an increasing number of patients are saving the blood from the umbilical cord of their newborn baby as a type of stem cell insurance policy in case that child should ever develop a disease that might be treated by administration of HSCs. Yeah. So yeah, I think that's a good point as well. It's an interesting point because, is that ethical, or should we use umbilical cord stem cells to sort of as an insurance for a living baby? Yeah, but I think we'll leave it there for today. And I think so. I think what you should try and take away from this session is the fact that isn't one answer here. There isn't a solution to this, and people do have different opinions as to when embryos, how embryos should be treated, which is kind of why we're having this discussion today. But I think the general consensus that we've come up with is that um, research into embryos should perhaps be allowed, as long as we can ensure that the ethical concerns are reduced, however that might be possible. But of course, this is developing all the time, and there is always new research regarding embryos and perhaps how they can be, and how perhaps new sources of stem cells can be used. So yeah, thank you everyone for listening. Yes, if you have any questions, please don't hesitate to contact us on our email or our Instagram, as we've got here.